Hi, my name is Dr. Coulter, and I'll now be talking about rhinoplasty surgery. This is often called a nose job. This is done to change the look of the nose, to help with nose breathing, or both. There are many different parts of the nose that can be shifted with surgery to change the appearance of the face. Your surgeon should discuss your concerns with you in detail. Common issues are a crooked nose, a bump or hump of the nasal bridge, or a droopy tip. Correcting these can help improve facial harmony and can boost self-esteem. The goal is to create a natural look where it's not obvious surgery was performed. Photos are taken before surgery to help with planning and afterwards to show the outcome. If nose breathing is also an issue, typically the nasal septum is straightened and turbinates made smaller. In a perfect nose, the left and right nasal airways are equal in size. The nasal septum divides the two sides. Some people are born with a crooked or deviated septum. More commonly, trauma to the nose can cause it to shift. The nasal septum is made of bone and cartilage, covered by special skin called a mucous membrane that has many blood vessels in it. There are also turbinates on each side wall of the nose. These can be large for a variety of reasons, causing blockage. If a patient has bothersome symptoms due to their deviated nasal septum or large turbinates, and medications are not helping sufficiently, rhinoplasty is an option to make the nasal airways more open. This surgery is typically done under general anesthesia while asleep. An incision is made on the undersurface of the nose, and the skin lifted to access the cartilage and bone of the nose. Crooked parts are removed and reconstructed. This typically takes about 3 hours, and patients usually go home on the same day. To help with healing, large nasal stents are placed inside the nostrils until they are removed at the post-operative visit about 1 week after surgery. Tape on the outside of the nose, and sometimes a cast, is used to help with swelling. All of this is removed about 1 week after surgery. It is crucial that the patient keep the nose very moist during recovery. Every 2 to 3 hours, apply gentle saline rinses and ointment inside the nostrils and over the incision, about here. The more frequent moisturization, the better and quicker the healing. There are small dissolving sutures on the bottom of the nose, which should not be manipulated too much. Ice over the nose may help with swelling and pain. Sleeping with the head of your bed elevated and eating a low-salt diet may also help with swelling. The nose is very sensitive, and pain is usually severe for a few days afterwards. Pain usually subsides after about 2 weeks. The nose will be swollen for the first 2 to 3 weeks. Minor swelling can persist up to 6 months. Especially if the nose bones have to be broken and reconstructed, there can be bruising around the eyes. There should be no strenuous exercise for 2 weeks afterwards. There are risks with the surgery, including severe bleeding from the nose. Minor bleeding almost always occurs for the first couple days. There is a risk that the appearance or function of the nose does not turn out exactly how you desire. It is hard to get the nose to stay perfectly straight. There is a small risk of infection in the nose. If the skin flaps of the nose are not put back together just right, a hole can develop in the septum, connecting the left and right sides of the nose, called a septal perforation. This is rare, but can cause annoying crusting, whistling of the nose, and bleeding. It can be repaired with another surgery if needed. The tip of the nose usually feels numb after surgery and may feel more rigid. This may be permanent. The upper teeth can be numb after surgery, as the nerve that goes to them travels in the bottom of the nose. This feeling usually comes back, but can take months sometimes. Very rare risks are damage to the skull base causing brain fluid leak. There are general risks with anesthesia. I hope to discuss further details with you soon.